Hi there. So today we're on day 7 of the steroid taper. This morning I took 10 milligrams of the prednisolone, the steroid, and I took 75 milligrams of the diclofenac and my normal 4.5 ml of LDN. I also take a supplement that Dr. Tennant, the arachnoiditis specialist in the US, recommends. So that's called prednisolone. So I took 100 milligrams of that this morning, which is a supplement that it's non-prescription that you can get, and they found that can help with nerve regeneration. So I've tried that, and as we know, the combination of drugs really helps me with the walking. So we're continuing on that. But today has been another good day. And I have just come out for a walk. I've been walking for about an hour, which is so good because today I had a lot of things to do. I edit videos for church and our online church, and I had a lot to do for that. We're also doing a lot of raising awareness at the moment for spinal CSF leaks, particularly patients that have clear brain imaging like I've always had. So we're taking to Twitter, and a friend of mine has had to go to the press because her treatment has been blocked for an obstetric leak. So we've been busy doing that. But I eventually managed to come out for a walk about an hour ago, which is really good because it was beginning to build up in my head. But I wanted to tell you today that actually I'm doing really well again. But yesterday was actually quite a hard day for me, pain-wise and symptom-wise. But I think I know, well, there's two reasons I think for that. Firstly, I did too much kind of bending and crouching down in the morning because for quite a few years we've had a cleaner, a wonderful cleaner, she's brilliant, who comes and helps us clean every couple of weeks because I have to be really careful about lifting and bending, and sometimes I've obviously been stuck in bed. But before she comes we do a lot of clearing up, and I did too much bending and kind of crouching down. I do have litter picker sticks, but I try and stretch my back a bit, and that flared it a bit. But secondly, what I wanted to tell you is my sleep is still completely out. Since the flare, since my sleep went, since being on the steroids, I'm getting to sleep okay, but then I'm waking up consistently between I go to sleep maybe about 10:30, 11, by about 12:30, 1, 2, I'm completely awake. And I often give myself a bit of time kind of to try and get back off to sleep, but I just can't. So I'm having to resort to the Zopiclone again, but I don't like being on the Zopiclone too long, although I always come off it. But the Zopiclone itself, even the 7.5, is still only giving me another few hours. So yesterday morning I tried to have a non-Zopiclone night, so I got to sleep maybe about 11, half 11, woke up at 2, and then I was just awake. And yesterday my body just took the toll of that, the lack of sleep, and my symptoms were just not good and flared. And by the evening I had to have a lie down in the day, and then in the evening things were getting bad, and by 7:30 I went to have a lie down and I was just falling asleep. And I kept falling asleep, and my husband was like, you need to get ready for bed, you know, before you fall asleep. So he kind of helped me get ready for bed, and then I just fell asleep. But the trouble is I woke up at 10:30, so kind of I knew that would probably happen, but I had no option but to go to sleep. But then I did take another Zopiclone because I knew I just had to sleep, and that kept me asleep till about 5, half 5, and then I did doze a bit after that, and today I feel so much better. So again, it's a thing of flares, and steroid treatment can just send your sleep off, and if your sleep is off, your symptoms are going to be worse. So it's really important that doctors know and you seek help to get help for your sleep. Now we're just hoping that my sleep settles down. If not, I'm going to have to go back to the GP, and we're going to have to look at better ways to get my sleeping back. In 2019, when I flared and was not sleeping again at all, we didn't understand the arachnoiditis, and things were in a really bad way. That's when I ended up severely suicidal, partly because I didn't sleep night after night after night. I not only went on the Zopiclone, but I went on a drug called Methylprednisolone, which is a antidepressant, but in low doses it also helps with sleep. Now that really helped me then, the combination of mirtazapine, Zopiclone, and at the time nortriptyline, that they were my kind of drugs that we used, and that really helped me for a time. But in the end I came off the mirtazapine and actually had insomnia when I came off the mirtazapine, which can be a problem. So I'm not really keen on going back on that drug. We're hoping that this, normally for me, I have to go on the Zopiclone for a bit and then things settle down. I always come off the Zopiclone and my sleep always settles down, but we're in that kind of phase where things are a little bit kind of a problem. So I'm going to give it another couple of days. If not, I will be back to the GP trying to think up a new kind of plan to get me sleeping, because after a while the Zopiclone does not work as well anyway. So it's that mix of not wanting to stay on it and it doesn't work as well. But I will keep you up to date with that, because that is such an important thing that's often missed, because often patients will say they're not sleeping, can I access sleeping tablets? And there can be a real blockage to sleeping tablets, understandably, because people can get addicted to them. But the thing is, within this diagnosis, within arachnoiditis in particular and the flares, sleep is so important, and actually insomnia is a symptom, so it needs to be treated as a symptom. Otherwise patients can end up very, very mentally ill, suicidal, and it's very, very dangerous. So I wanted to just add that in. But today is a good day. I actually, my head's been good, my back's been good, I've got loads done. I've been having to stand in one position at the computer, I've having to be sitting down editing videos, as well as my typical wandering around, and actually it wasn't too bad, and I didn't need to go for a walk till about 3:30, but I was, by 3:30, you know, my husband wanted to talk to me about something and I was like, we can't talk about it now because my head's going, my back's going, and I'm getting agitated, and he just knows that I won't listen as well if he tries to talk to me then. So I've come out for an hour walk and it's really helping me. But yes, so that's my summary for today, and we will catch up again soon. Bye for now.